Chemotherapy uses powerful drugs to destroy cancer cells through the body and is used to treat both limited and extensive small cell lung cancer. Dr. Scott Brook of Desert Comprehensive Cancer Center gives us the latest on chemotherapy for lung cancer patients.
Chemotherapy, exactly what it means. It's chemical therapy. We use it in pretty much all types of cancer. There are different regimens, different types. The way that they act on cancer cells and the way that they attack cancer cells are different per each drug. And the real goal of using chemotherapy is to try to shrink tumors, kill the cancer cells, and prevent them from spreading. In lung cancer, chemotherapy is used in different ways. It depends really on the stage of the cancer. As far as trying to cure the cancer, to prevent it really from ever coming back, to what we call reduce the risk of a recurrence of the cancer, versus in a advanced metastatic setting when it has spread to distant parts of the body, to trying to prevent, one, the cancer from getting worse than it already is, trying to help improve any symptoms that might actually arise from the cancer, and maybe even get a response as trying to shrink the cancer that is already there. In early stages of lung cancer, you don't necessarily need to actually receive chemotherapy. If someone has surgery, ultimately it could depend on the size of the tumor and whether or not that there are lymph nodes involved. Based off of that, chemotherapy may or may not be indicated.
Dr. Brook discusses the advancements made in chemotherapy for lung cancer.
Lung cancer, there are different cell types that designate it as a small cell lung cancer versus a non-small cell lung cancer. And then actually within non-small cell lung cancer, there is different cell types, breaking it into what's called a squamous cell lung cancer and an adenocarcinoma of the lung. And they have done studies and they have found new chemotherapies that actually have added benefit on one lung cancer cell type versus another. They're doing more studies or getting down to the genetics of cancer and find out not just how we can kill the cancer cells, but also trying to prevent the cancer cells from growing. How can we stop at the molecular level from actually creating more cancer cells? And with that, they have found certain mutations in the cancer cells that now we're able to test for. And if that mutation is actually present, the person might actually benefit from an oral targeted agent versus a chemotherapy. If it's an early stage lung cancer that requires chemotherapy, it's for a finite amount of time. How much time? It really depends on the stage of the cancer. For stage 4 or metastatic lung cancer, there really is no kind of end point for the chemotherapy. The goal is to try to treat for as long as we can to get the best response and to try to really prevent the cancer from getting any worse. In lung cancer, chemotherapy and the targeted agents, as I discussed before, are very successful. They really do help in the early stages, really help reduce that chance of a recurrence of the cancer. And for those patients that are metastatic, it can really help try to prolong their survival and really keep their quality of life at a very manageable and a good level of quality of life to keep them feeling well and symptom-free.